Welcome back to the show, and we're our sports medicine tips, sponsored by Associates in Orthopedics in Sports Medicine. We've got Dr. Mike Wilson with us tonight. Doctor, welcome to the show.
Good, Bill. It's nice to be here. Thank you for having us.
Well, I think you've got a great topic, and why don't we jump right in and talk about head injuries and concussions. And talk to me about that stat we were talking a little bit about off camera.
Well, what we found out, and there's some published data that shows there's about 17,000 injuries in the high school athlete in football at this age group per year in the United States.
That is just a tremendous number. I would never guessed it would be that high.
And it's gone down some just from good head injury or headgear protection. Out of those 17,000, there's actually about 8 deaths per year in the United States.
So I think people have always known concussions are serious, but that really tells you how serious it is right there when you have that number of deaths. Talk a little bit about if you suspect a kid has a concussion, what symptoms do you look for, or what things can a parent look for at home if they suspect their child has had a concussion?
Well, first thing we do is on-field management. We look at them. We want to know, one, if they've lost consciousness or not. And if there's a loss of consciousness, it helps us in grading. Then we use some sideline tests where we check for amnestic response, give them a little mental mini status exam where we give them questions and ask them things that they should know the answer to. And that's what we do on the sidelines. If we suspect someone has a concussion, they need to be monitored for 24 hours or 48 hours, and we try to instruct the family and the coaches on what to look for. The acute findings will be amnesia, loss of consciousness, difficulty in concentrating, headaches and dizziness. Sometimes we'll actually be nauseated and throw up. Delayed responses that can occur over 48 hours are fatigue, not sleeping right, having bad sleep habits, and some depression.
I think that's extremely interesting, and that leads into the next point we were talking about, because talk about the second impact syndrome and why it's so important to recognize a concussion because of that second impact.
Well, there's a phenomenon called second impact syndrome, and that what happens is a child or an athlete who is still symptomatic has some residual effects from the first concussion, gets back into play, and they sustain a trauma. And at that time, the brain goes through an auto-regulation process, and it's a dysfunctional process where you get severe cerebral hypertension, massive edema, brain swelling, and fatality rates are about 50% with this.
So that just really makes the point of how important that first diagnosis is?
That's correct, and not returning to play too quick. And a lot of times the second impact syndrome can occur without a loss of consciousness on the second injury.
Well, let's talk about returning to play. What are the steps that you go through to ensure that an athlete's ready to return to the field?
Depending on the grade of concussion, we have different steps of allowing the player to get back. A low-grade, grade 1 concussion, basically we keep them out for a week and they have to be asymptomatic. During the time, if we have a documented concussion, we will stress them, we will get them to do some non-contact exertional things that will try to bring on symptoms such as nausea, fatigue, or dizziness. And if they develop those symptoms during the 1-week trial period, then we keep them out longer. Same thing for a grade 2. We keep them out for 2 weeks with 1 week asymptomatic and stress them again the same way.
Now, talk a little bit about mouthpieces and concussions. I know there's a lot of out there about the importance of mouthpieces in preventing concussions.
There really hasn't been a lot of data that supports mouthpieces in head injuries and concussions. There's an article that I was looking at today that didn't really talk much about it. It's more of the headgear than an appropriate headgear in contact.
What were they saying? Something about the helmet and the headgear as far as concussions go?
Proper fit, or the key things, making sure that it fits appropriately. It's not too loose. It's not too tight. And some sports aren't really, it hasn't been shown to be helpful, including soccer. So headgear in soccer is really not beneficial.
Or basketball, I guess,
basketball.
As well, yeah. Well, this is a great topic, and we really appreciate you coming on the show tonight and educating everybody a little bit on head injuries and concussions.
Thank you very much for having me.
All right, thank you. Stay tuned. We'll be back after these messages.